Specific to older adults is the Medicare program, although it does serve a certain number of people under the age of 65. There are restrictions that come with Medicare just in terms of people's ability to access particular doctors, and unfortunately the trend that we're seeing is fewer and fewer doctors are willing to take Medicare patients. So.
It's hard to get things met, It's hard to get things situated because they keep giving you a lot of paperwork to do. The same thing over and over there, to keep asking you for it. They try to aggravate you so that you quit applying for it because they don't want you to have it.
An HMO kind of model or a managed care model in which there is an assigned number of providers who are contracted or who work within that managed care organization to provide care. As a patient or as a client, they may have to give up the doctor that they've had for a long period of time because that doctor is not part of that particular pool. There are geriatric programs, and it's a marvelous model of care to have a geriatrician who is someone who's trained particularly to look at the syndromes that older people tend to have, the chronic illnesses and the overlap in different illnesses. However, at the same time that I say that, they're few and far between. We see the numbers of geriatricians and the number of students, med students who are going into that area dropping. The same is true for nursing, the same is true for social work. So we really, from my viewpoint, we're in a crisis of sorts in terms of not being close to being prepared to deal with the numbers of older adults coming along. I think that many providers are making the decision not to accept Medicare. I think it's twofold. One is there are a number of providers who I think have the perception, or it may be reality, that caring for older adults takes a longer period of time than it does to take care of a younger adult. So it's very hard to do all that you need to do in a 10-minute visit, in a 15-minute visit. It can take that long just to get the list of medications and even hear what the issue is. So that's one component. It's never been terribly popular to take care of older people, and part of that has to do with our perceptions and our media in this country. At the other end of the spectrum is that we do not reimburse at the same rate. Medicare is not providing the same degree of reimbursement for some of the same procedures that other insurance companies do, and so it becomes a bottom line kind of issue. But I think the two of them, unfortunately, intersect, and it's just for many providers, they don't feel that they have the time, and nor are they all that interested in serving older adults.
When people have a job, they're supposed to do it, and this is to help people. It's not to hurt them, and they do is put a stumbling block before you so you can't get the insurance that you need to take care of you at the nursing home.
What I'm seeing is that many of the older adults are concerned that they will fare badly in the process of healthcare reform. The statistics don't seem to bear that out, but there's been a fairly effective media campaign, I think, that has caused older people to feel that they will lose ground as other people gain ground, rather than being able to look at it as a whole, that we will better serve all of the older adults as well as younger populations if we reform the healthcare system. I understand their concern. I'm an optimist, and I believe that it will end up better serving everybody as a result of healthcare reform, particularly all of the people who are underinsured or uninsured.
if I hide in my bed with the lights on the floor, wearing 3 layers of coats and leg warmers. I see my own breath on the face of the door. Oh,